I work registration at a Munich hospital. An American tourist walked in holding his arm at an odd angle. He'd fallen off his bike on the Azar Trail. Before I could ask his name, he shoved his phone at me. I need to call my insurance company first. What's your hospital's billing code? I told him we'd treat him, then sort paperwork. He physically stepped back. No, I need pre-authorization. What's the out-of-network penalty here? I explained, we don't have networks. Everyone pays the same. He stared at me like I'd spoken Martian. That's illegal. Hospitals can't refuse to bill insurance. I said we would bill insurance, but he was getting treated now regardless. He looked genuinely terrified. You're trying to trap me with hidden costs. His arm was clearly broken. I called a nurse. While she led him away, he kept yelling about needing itemized estimates. The nurse later told me he cried with relief when she said his total bill would be maybe 200 euros. He'd been bracing for 20,000. A woman once asked where our hospital parking payment machine was. I pointed to it. She said, no, the validation machine. We don't validate parking. She insisted American hospitals always validate if you're a patient. I told her parking costs to euros. She argued for 10 minutes that this was discrimination against patients. She wanted to speak to hospital administration about our parking scam. My supervisor told her the same thing. She paid the 2 euros while muttering about European socialism. Those weren't isolated incidents. Americans and German healthcare mix like oil and fire, by the way. If you appreciate someone actually breaking down these cultural collisions with real stories, instead of surface-level hot takes, this channel is where the truth lives. Subscribing just makes sure you don't miss the next reality check. Our hospital pharmacy handles prescriptions. An American man presented one from his Florida doctor for blood pressure medication. Standard stuff. I told him 8 euros. He didn't move, just stared. Then 8 euros for what? For the prescription. 30 pills. No, I mean, what's my copay after insurance? That was his price. Total, he made me repeat it 4 times. Then he asked what his insurance was being charged. I explained the drug costs 8 euros. Period. Everyone pays 8 euros. No negotiations, no markup. He pulled out his phone and Googled the same medication in America. His face went gray. This costs me $45 at home with insurance. I nodded politely. He looked at the pills like they might explode. What's wrong with them? Are they expired? Counterfeit? I showed him the packaging. Fresh batch. Properly licensed. He took them but spent 5 minutes photographing everything in case I get sick. And these are the kinds of moments most people never hear about because they don't fit the narrative. If you're the sort of person who wants the real picture of life abroad, stay ahead of the scroll. Subscribe now and don't let the algorithm decide what truths you miss. The next patient in line was German. Same medication. She paid her 8 euros and left in 30 seconds. A pregnant American woman came for a routine checkup. Our system scheduled her with an OB/GYN. Free appointment. She arrived an hour early and approached my desk with a folder. Thick folder. She laid out insurance cards, passport, previous medical records, and what looked like a legal document. I need to confirm my coverage before the appointment. Here's my international insurance rider. What forms do I fill out? I told her she just needed to show her passport. She blinked rapidly. For billing purposes? No, just to confirm residency status. Her insurance would be billed automatically if she had German coverage, or we'd send one bill afterward if she didn't. She physically couldn't process this. You don't need to verify my coverage limits, my deductible status, whether my plan covers this facility. None of that. She'd get seen, then get one bill. Simple. She sat down but kept glancing at me like I was lying. After her appointment, she came back to my desk. The doctor didn't mention payment once. Is that normal? Completely normal. She shook her head slowly. In Texas, my OB brings up costs during the actual exam. She left looking dazed. Later that week, she sent an email thanking us for the most stress-free medical experience of her life. The bill was 90 euros. I was covering the ER intake one night. An American college student came in with his girlfriend. He'd twisted his ankle badly playing basketball, possibly broken. He was sweating and pale, but not from pain. From panic? How much will x-rays cost? What about the doctor visit? If they cast it, what's that run? I told him we'd handle treatment first, billing later. He literally grabbed my arm. Please. I need to know if I should leave. I can't afford thousands of dollars. His girlfriend was crying. They were both convinced this would financially destroy them. I explained the entire visit, with x-rays and a cast if needed, would likely be under 300 euros. He made me write it down. Did. He stared at the paper, then asked if that was just the down payment. No, total. He started laughing. Not happy laughing. Hysterical stress laughing. The kind where you can't breathe. His girlfriend had to calm him down. We x-rayed his ankle. Severe sprain, not broken. Wrapped it, gave him crutches, sent him home with painkillers. Total bill, 140 euros. He asked for 12 copies of the receipt. Said his friends back home would never believe it. I was working the cardiology department. An American businessman, maybe 50, came in for chest pains. We admitted him immediately. Ran tests. EKG, blood work, the standard protocol. He kept asking when someone would discuss pricing. The nurses ignored him. They were busy keeping him alive. After his tests came back clear, just stress and acid reflux, a doctor explained the results. The American interrupted constantly. What's the billing code for the EKG? What tier is this consultation? The doctor looked confused. I'm telling you about your heart. The patient snapped. I'm asking about my wallet. The doctor said someone would send a bill in a few weeks. The American demanded an itemized breakdown immediately. He refused to leave without it. My supervisor finally printed a cost estimate. Around 400 euros for everything. The American went silent. Then, that's impossible. And a visit alone costs me $1,500 in Chicago. You're telling me full cardiac testing costs 400? My supervisor confirmed it. The American said, and I quote, "What kind of backwards country is this? How do hospitals make money?" My supervisor just walked away. A family of American tourists brought their daughter to our clinic. Bad ear infection. Needed antibiotics. Simple case. The father asked about pediatric specialist fees versus general practitioner fees. I told him this was a GP and it's free. He said free like covered by insurance. No, free like no charge. He squinted at me. What's the catch? Do we pay the doctor directly? There's no catch. Healthcare for children is covered? The mother jumped in. We're not citizens. We're tourists. Doesn't matter for emergency care. Their daughter needed antibiotics. We weren't going to let her suffer over paperwork. The father kept pushing. Someone's paying for this. Who? German taxpayers, I suppose. He scoffed. So we're freeloading. I didn't engage. The doctor prescribed antibiotics. The pharmacy bill was 6 euros. The father handed me a 20 and told me to keep the change as a tip for the free healthcare. Explained we don't accept tips. He insisted. I refused. He left the 20 on the counter and walked out. I donated it to the hospital charity fund. Some Americans physically cannot accept that healthcare isn't a transaction to be optimized. Our neurology department had an American grad student who'd been in Munich for 6 months. She'd been getting migraines. Severe ones. Finally came in after ignoring them for half a year. The neurologist asked why she'd waited so long. She said she'd been saving money for the appointment. The doctor was horrified. You've been in pain for 6 months because of cost? She nodded. I have insurance, but I needed to budget for deductibles and copays. The doctor informed her that with German student insurance, this appointment was free. The MRI she needed? Free. Any medication? Probably under 10 euros. She cried in the exam room. Not from relief, from anger. She'd suffered for months because she assumed German healthcare worked like American healthcare. The doctor told her to come back immediately if symptoms returned. Don't wait. Don't worry about cost. She asked 3 times if he was serious. He was dead serious. She left with a prescription and a phone number for mental health services she recommended, given the stress she'd been under. That was also free. The worst case I ever saw started normally. An American man in his 60s needed a hip replacement. Not emergency, but necessary. He'd been limping for 2 years. A relative in Munich convinced him to get it done here. He consulted with our orthopedic surgeon, who scheduled the operation. Before surgery, he asked to speak with billing. They sent him to me. He wanted the full cost breakdown. Surgery, hospital stay, anesthesia, physical therapy, everything. I compiled it. Roughly 8,000 euros total. He sat there doing mental math. Then he started laughing. That same hysterical laugh I'd heard before. I asked if he was all right. He said, "You know what this costs in Florida? $70,000. My insurance would cover maybe 40. I'd be paying 30,000 out of pocket." He kept laughing. I'm sitting here thinking, 8,000 euros sounds expensive. That's about $9,000. I'm saving $21,000 by flying to a foreign country and paying out of pocket. I didn't know what to say. He continued, "And your version includes physical therapy. Mine doesn't. I'd pay extra for that." He shook his head. "I've been putting this off for 2 years because I couldn't afford it. I've been in pain for 2 years. Walking with a cane, and I could have flown here, had surgery, recovered in a hotel for a month, and still spent less than getting it done at home. The surgery went perfectly. His recovery was smooth. 6 weeks later, he came back for a follow-up, walking normally. Cane. The surgeon asked how he felt. He said, "Physically great, but emotionally confused. I can't stop thinking about people back home who can't afford to fly to Germany, who just live with the pain because the system's designed to bankrupt them." The surgeon nodded quietly. The American asked, "How do you do it? How does this country make healthcare affordable?" The surgeon said, "We decided healthcare is a right, not a business. Everything else follows from that choice." The American left Germany 2 days later. Before he flew out, he stopped by the hospital to drop off chocolates for the staff. He told me he'd be writing to his congressman about what he'd experienced. I smiled politely, but I've heard that before. They always say they'll fight to change things. Then they go home. America stays exactly the same, we see. Americans weekly who've had their lives saved by healthcare they could actually afford. They're grateful and shocked in equal measure. It never stops being surreal that the richest country on earth treats healthcare like a luxury product. But that's not my problem to solve. I just register patients and watch Americans discover that medicine doesn't have to destroy your finances. Some of them cry, some laugh, some get angry. All of them leave different than they arrived. If seeing the world clearly past the myths we've been sold matters to you, you belong here. I'll keep telling these stories either way. But the people who subscribe are the ones who refuse to stay in the dark. Next time someone tells you American healthcare is the best in the world, ask them if they've ever needed a hospital in Germany.